everyone, welcome to my YouTube channel. My name is Ying and I'm a third year nursing student from UTS. This is an in-service regarding contemporary nursing practice. The chosen topic is workplace bullying in the clinical setting. The purposes of this video are to help those new grad nurses to understand the impact of bullying on both patient safety and work health safety. Go a step further, I will also discuss the responsibilities and leadership quality of new grad nurses in relation to managing bullying. At the end of this video, you should have some ideas about what bullying is and how you can mitigate the problem with effective leadership skills. So what is workplace bullying in nursing? It refers to a situation where nurses repeatedly and over a prolonged period of time is exposed to abuse, isolation, discrimination, and harassment. They might be placed in an asymmetrical position where they are not able to defend themselves from unethical or even illegal behaviors. Firstly, I'm going to explain the significance of workplace bullying and why it is a problem. All discussions are based on different peer-reviewed literature and my own experience. Nowadays, nurse-to-nurse bullying has become an issue within the clinical environment, which can negatively affect patient safety, personal health, and a healthy work environment. The reason why I would like to explore this topic is due to my own experience. I saw the accumulation of psychological pain and have witnessed how it could manifest in anger, disappointment, and desire to bully others. Nurses who get bullied are at high risk of suffering emotional pain and even physical injury. More specifically, it may include damage to self-esteem, self-worth, loss of confidence, and incompetency. Nowadays, absenteeism from work due to bullying is on the rise. It has been demonstrated that those victims of bullying tend to leave their work, causing inadequate competent nurses available to patient care and affecting those who are still working in an unhealthy workplace. Some nurses do not have awareness or support to cope with the situation. Therefore, the primary solutions that come to their mind is to stay away from work. In other words, extra burdens are added to the remaining staff, causing a decrease in job satisfaction, weaker team collaboration, and high turnover rates. Furthermore, the biggest impact of bullying is the quality of patient care. Why? On one hand, nurses are less likely to call for assistance if they think that they might be ignored or criticized by other staff without a reason. Thus, patient safety is not protected if patients cannot receive proper care as they need. On the other hand, nurses are less likely to demonstrate attentiveness when they carry negative emotional burdens that are caused by bullying. It increases the risk of providing patient care that is not safe, such as medication errors. In order to prevent and manage workplace bullying, a series of advice and policies have been introduced to both nurses and employers. For instance, nurses who have been bullied by others are encouraged to report to their manager and supervisors, and they can get free legal advice from the Fair Work Commission. Employers are expected to strictly follow all guidelines and policies to deal with different situations. Other current policies and guidelines, including anti-bullying advice lines and prevention and management of workplace bullying in New South Wales Health, can deal with the problem. So how does effective leadership contribute to mitigating workplace bullying? A research has found that just under half of nurses have suffered workplace bullying. A key for effectively mitigating workplace bullying is to transform from a blame culture to a learning culture. A reliable leader will work to match the strength of employees with broader organizational needs. All nurses, especially new grad nurses, consider clinical leaders as role models. They mainly observe behaviors, knowledge, and decision-making and gain feedback from senior nurses. It means that their future practices can be easily influenced by the performance of current leadership. Effective leadership is critical in facilitating staff development and high quality of patient care. Creating a healthy workplace culture that does not tolerate bullying, helps to moderate the negative impacts of bullying. An effective leader would label bullying as unacceptable and inappropriate events. They should take preventive actions to protect staff, patients, and others. Nursing leaders, especially executive leaders, play important roles in working with other executives or policy makers in the organizations to create strategies and policies to address consequences for bullying at all levels. The World Health Organization has identified that the health and well-being of nurses has negatively affected by a rise in workplace bullying. A descriptive study has found that new grad nurses and those who work casual and have less experience are often the targets of bullying in the workplace in Australia. It is very important for new grad nurses to develop the leadership skills to influence practice environment. They have the responsibility to utilize their leadership skills to identify and respond to the challenges faced. I was asked by some other students if new grad nurses would play the role of a leader. The answer is yes. It is possible that new grad nurses work as a leader or in charge on the ward at some point. As a junior leader, new grad nurses must practice within both ethical and legal boundaries in order to prevent and manage bullying. According to A Nurse Guide to Professional Boundaries, nurse own values, attitudes, and needs must be self-reflected. All circumstances, such as nurse-to-nurse bullying that could potentially affect patient care and therapeutic relationship, must be aware. Cultural safety, effective communication, and adhering government policy are the key of management. Firstly, discrimination is regarded as a form of bullying. As we all know, Australia is a multicultural country. Everyone needs to respect others regardless of others' cultural backgrounds and religions. New grad nurse leaders should create a culturally safe environment via role modeling and support the dignity and rights of others. Also, developing communication skills can help with avoiding misunderstanding and misinterpreting. More importantly, leaders are accountable for promoting professional behaviors and a safe working and patient environment based on government policies such as Code of Conduct. For example, if you're working in an organization where bullying has already existed, you must initiate cultural changes. Overall, continuous professional development such as cultural safety plays an important role in improving competence to meet their obligation to provide safe and effective care. I understand that it will be very difficult for a new grad nurse to speak up and challenge others. Considering the experience and educational level of new grad nurses, I'm going to talk about some tips that you can work on to discourage bullying. The first step is recognizing the bullying behavior. You need to spend time on observing others' behavior. At the same time, you ask yourself, are they communicating in a professional way? Are they showing their respect? The next step is separating from the bully. Criticism such as "you are stupid" is a type of bully. A powerful way to minimize the impact of bad behavior is stay away from bullying and do not take it on yourself. The third step is to speak up the problems and confront the bully. A way to face bully is to name the behavior. For instance, if the bully is yelling and criticizing another nurse with the word stupid, you can address the behavior as "I heard that you were yelling and saying that she was stupid." In this way, you are passing on the message to the bullies that you are supporting the nurse and aware of his behavior. It helps to decrease and stop their behaviors in the long run. It might be difficult for a new grad nurse to speak up for others and even yourself. Therefore, there are some tips for you. After observing some bullying behaviors, you can write down how you would describe those behaviors. You can also name the behaviors and practice addressing them until you feel confident with your words. The next time you will be prepared when you face the same situation. All steps that I've mentioned above are supported by government policies and literatures. In fact, making this video has also helped me to develop my leadership skills since I have to think and teach like a leader. I hope this in-service has provided you with the overview of workplace bullying in the clinical environment. Hopefully, this information and suggestions can help you with overcoming workplace bullying and become more confident in your future practice. This is my reference list. Thank you for watching.